All good morning, everybody. As you see, we will record the meeting today because some colleagues couldn't join. So good morning again. My name is Esther Ruiz. I work for UNICEF in the Regional Office for Latin America and the Caribbean. I work in the child protection section and I'm in charge of violence issues. I will go with you through the agenda today and I will be introducing the great colleagues we will have today. Starting with this journey on the Inspire strategies. So we will have a little introduction first from Ms. Silvana Luciani from PAHO. Then we will have Ms. Stella Ayo Odongo, Director of Pathfinding Fraud and Violence. And then we will have Ms. Anne-Mary Williams from CARICOM for the introduction. And then we will jump to the introduction to Inspire. We will have an overview of the 7 strategies to end violence against children by our colleague Brita Baer from PAHO. Then we will have the first strategy in more detail. We will go to the implementation and enforcement of law with Diane Farias from UNODC. And then we will go on a specific good practices of ending corporal punishment from Bess Herbert and Sonia Bojito from the Global Initiative to End Corporal Punishment, and on a specific example from a country in the region with Ms. Hazen Blair from Jamaica, that we have had the pleasure to have her in other meetings with her great knowledge and her compromise to end violence against children. Finally, we will have time for questions, answers, and suggestions from you. And then we will go to the conclusions and next steps. And this is just a first meeting on Inspire. The idea is that we will have at least 3 more to go in depth in the other strategies. And the idea mainly is to share with you also about your experiences to end violence against children and adolescents. So we have already 64 attendees, so we will start with the introductions. So I will ask Ms. Silvana Luciani, who is the Unit Chief of Violence and Injuries, is the Department of Non-Communicable Diseases and Mental Health from the Pan American Organization for Health, to start with her remarks. Thanks a lot.
Thank you very much, Esther, and good morning to everyone. Greetings from the Pan American Health Organization here in Washington, D.C. It gives me tremendous pleasure to welcome you all to this meeting on Inspire, the 7 strategies to end violence against children and adolescents, with the purpose to discuss the strategies and to also increase our collaborations across sectors on preventing violence against children and adolescents, particularly in the Caribbean subregion. It gives me great pleasure to welcome not only the government representatives that we have connected here today, but also our partners from UN agencies, from UNICEF, from our partners from the Global Partnership to End Violence Against Children, and all of you from sectors beyond health to education, social services, justice, academia, and civil society groups. So we're really looking forward to a nice, rich discussion from everybody's perspectives from this multi-stakeholder, multi-perspective view, because we know that the topic of today's meeting is something that is common to all of our work, and that each one of us from our particular sectors and institutions has a really, really important role to play to address violence against children and adolescents, including homicide. In fact, the region of the Americas has one of the highest homicide rates in the world for those 18 years and younger. It's more than 3 times the global average. And among the top 10 countries with the highest homicide rates, we find several Caribbean countries. So this makes the topic an even more urgent priority for multi-sector action. And of course, beyond deaths, we know that the health and social costs of violence cannot be overemphasized, from injuries that require emergency treatment to the impact on mental health and trauma, to the adoption of unhealthy behaviors that have consequences across the life course of children and adolescents, to the devastating impacts that violence has on educational development, community inclusion, tourism, and economy, just to name a few. So these societal costs, we know, from violence are highly preventable. And that's what's going to bring us together, is this common theme of preventing violence against children and adolescents. And from PAHO, we're really proud to be working with all of you on violence prevention and to also be one of the co-authors of INSPIRE, which is a technical package based on evidence for interventions to reduce violence against children and adolescents. And one of the INSPIRE strategies calls for a strong health system response, underlying the important role that frontline health workers and health services have to identify at-risk groups early, to provide them with the needed interventions, the support, the care. And attention to this health system response to violence is particularly timely right now as countries rebuild their health systems post-COVID-19, as we look towards the future of having a strong and resilient health system and making sure that violence prevention is an integral part of strong and resilient health systems. The pandemic we saw not only increased the risk of experiencing violence for many children and adolescents, but it also affected their access to essential health and support services. And therefore, from PAHO, we are really looking to help strengthen that health system component of the INSPIRE package and to collaborate with all of you from other sectors and other parts of society as well. The INSPIRE package really does represent that robust starting point from which we can adapt it to the context and the realities and the needs of the Caribbean. The INSPIRE package is a global one, so therefore the nuances, the specificities for the Caribbean culture, community, and health services will need to be adapted, and that's what we're looking for in today's meeting and this whole series over the coming months, to really look at what are some of the opportunities to achieve this multi-sector approach to violence prevention in children and adolescents. How can we apply and adapt INSPIRE in the Caribbean? How can we exchange experiences and explore strategies together so that we can agree on a path forward for that multi-sector response for violence prevention against children and adolescents? So I thank you all in advance for your participation, your active participation, sharing your ideas and experiences, and we look forward to a very successful INSPIRE meeting. So thank you very much, and over to you, Esther.
Thanks a lot, Silvana, for these words. And I would like to give the floor to Ms. Stella Ayo-Odongo. She is the Director for Pathfinder Countries, Global Partnership to End Violence Against Children. Her areas of expertise are child rights, child protection, social policy expert, and an advocate for social justice. She's a motivated leader and developed practitioner with over 20 years of progressive experience in strategic leadership and development. Please go ahead. Thank you.
Thank you very much for the opportunity, and I take this opportunity on behalf of the Global Partnership to End Violence Against Children to welcome you all to this sub-regional conference on INSPIRE that will focus us on learning, sharing experiences, and also building our capacity to advocate and promote INSPIRE strategies, but above all, use that as a vehicle to end violence against children. As already mentioned, I work with the Global Partnership to End Violence Against Children, but just to give you an overview of the Global Partnership to End Violence Against Children was launched in 2016 alongside the INSPIRE strategies. So I like to refer to them as twin sisters or twin brothers because they were launched at the same time. And the Global Partnership has about 4 work streams. One of the work streams is ending corporal punishment, and today, I'm privileged to have my colleagues from Ending Corporal Punishment who are going to be sharing experiences on that specific stream of work. We also have a work stream that is on Safe to Learn, and the other one is on Safe Online. And then the last one is on Pathfinding Initiative, which I head. Now, the Pathfinding Initiative is what promotes mobilizes countries around their agenda to end violence against children and mobilizing political will around countries that have made a commitment to end violence against children. Today, we have up to about 37 countries that have made this commitment to champion the cause to end violence against children. And I'm so happy to note that Jamaica, which is also among the 37 pathfinding countries, is going to be sharing their experience today. Like I already mentioned, we are thrilled to be part of this training and seeing that it's bringing together a lot of sectors that are coming together to learn, to share and learn from each other. One thing that we find critical about this meeting is that it is going to equip us with the skills and knowledge that we need to have an impact on the agenda to end violence against children. Violence against children, like you have already heard from the previous speaker, affects many children. More than 1 billion children experience violence each year. And the impact is huge from health. We have already heard about health, from protection, from their well-being, from the emotional well-being, and all this impact on the way they deliver their potential as children. Although this situation is really, really bleak and we're worried about it, there is the opportunity which is offered by the Inspire strategy that was launched in 2016. And the Inspire strategy has evidence-based packages that have shown that it is possible to prevent and end violence against children. And the Inspire strategy has made a lot of contribution, as I'll share with you shortly. Over the years, over the 5 years that the strategies have been in existence, we've seen the Inspire strategies contribute for pathfinding countries to understand the drivers of violence and structure their country level work in terms of how they can prevent and respond to violence against children. We've also seen the Inspire strategies as being an opportunity to unlock potential for political will and championing the cause to end violence against children. But most importantly, it has been a very, very essential tool in achievement of Target 16.2, which calls for ending all forms of violence against children and exploitation of children, ultimately contributing to ending violence against children by 2030, which is contained in the Sustainable Development Goals. As the Global Partnership to End Violence Against Children, we're excited to be here. We know that this is just the beginning of a conversation that will contribute to the bigger agenda, that as actors and stakeholders in the field of violence against children, we need the skills, we need the expertise to be able to drive the agenda. And the Inspire technical package or the strategies give us the 7 strategies that can help us in driving this agenda. I'm so happy to hear that there's so many of us who have signed in to listen in, but also to share. I want to encourage us all that through the presentations, we need to share our experiences. We are going to share specifically on the work that we have done on corporal punishment, but I'd like you to also share on the work that you've done, because I believe that amongst us here are experts who do their work on the ground, and we really, really want to learn from you. As actors at a global level, we benefit a lot from you who are in country to share and we also learn. And so we can create the linkage between the local interventions with the global. Although we are meeting virtually, it is my belief that the skills and expertise that we'll acquire through this engagement is going to make us champions of ending violence against children. I want to say that I'm hoping that we will use this platform to openly share, to learn, to expand our individual and collective networks, and above all, just make this the beginning of a bigger conversation. As the Global Partnership to End Violence Against Children, central to our mandate is to build a movement of practitioners, of UN agencies, of government agencies who will champion the cause to end violence against children. And this platform provides each one of us who is present here that opportunity to connect with those who have joined, not just because you're from the same country, but because you share the same vision, where we would want to see a world where every child and every boy grows up safe, secure, and in a natural environment. Thank you very much for listening, and wish you very, very good deliberation. This is just the beginning of the conversation, and I look more to many, many conversations that will come ahead. Thank you.
Thanks a lot, Ms. Stella. I'm really sorry. I know that you're trying to write on the chat, but the chat is not working. So we are really sorry. We are trying to solve that. In case you want to introduce or make any question, you can do it in the question and answer link while we resolve the problem with the chat. We are really sorry. So we will continue with the introductions, and we will have now Ms. Anne-Marie Williams from CARICOM. CARICOM is a key partner for all of us in the Caribbean. Ms. Anne-Marie Williams, she's the Deputy Program Manager of Gender and Development with the Directorate of Human and Social Development of the CARICOM Secretariat. She is also the co-chair for the Caribbean Spotlight Regional Initiative to End Violence Against Women and Girls Regional Technical Advisory Group that provides technical oversight of the program that many of you, I think, will be familiar with. Please go ahead, Ms. Anne-Marie Williams. Thanks a lot.
Thank you very much, Esther. Good morning to everyone. Let me say that it's a pleasure for me to be bringing some remarks on behalf of CARICOM and behalf of Inspire this morning. Once again, thank you. All Latin American and Caribbean countries have adopted the Sustainable Development Goals and made significant commitment, increasing evidence-based information on and accelerating action toward eliminating violence against children, as well as gender-based violence against women and girls. In the Caribbean, specifically the 15 full member states of the Caribbean Community CARICOM, there are policies, action plans, and legislation to protect our youngest citizens or children, albeit some member states are more advanced on emerging issues governing child protection, children, and adolescents. The draft CARICOM Regional Gender Equality Strategy, as well as the Prevention of Violence Against Children strategy, are both regional frameworks from CARICOM designed to assist member states to eliminate violence against children. The Global Status Report on Preventing Violence Against Children, which was released during the pandemic, reminds us that violence against children is widespread in every Latin American and Caribbean country where it is measured. Although prevalence varies by setting and type of violence, data published in the region in the past 6 years highlight the frequency with which physical, emotional, and sexual violence against children occur and where they happen: in the home, in school, in the community, and online. Studies measure different types of violence in these settings, and it is clear from the data that physical violence is the most frequently occurring across countries with comparable data: Colombia, El Salvador, Haiti, and Honduras, which is always more Latin than Caribbean. But be that as it may, the median prevalence estimate that both boys and girls is 31%. Physical violence prevalence estimates also have the highest range across studies, with range of 42 percentage points. Sexual violence is also prevalent, with a median prevalence estimate for both boys and girls of 14%, and a much smaller range across studies with comparable data of 23 percentage points. And as you're aware, the violence increased during the height of the COVID-19 lockdowns. It is important to point out that among the types of violence, sexual violence is undermeasured in surveys across the world and across the region, as many countries have no current or reliable data on sexual violence against children. Yet we know a few things. Children who experience violence often experience multiple types of violence across settings. It is more common for research to measure the prevalence of types of violence than to measure how many types any one child may have experienced, as it is less invasive. When this occurs, it makes it difficult to understand if children are experiencing multiple types of violence, or if it is different for children experience different types of violence. There is increasing evidence in Latin American and Caribbean studies of what is known as polyvictimization, ranging from a quarter to a third of children experiencing more than one type of violence in regional studies. Emanating from the same studies is evidence that girls experience a broader spectrum of victimization as opposed to boys, including in the cyber world and in the electronic world. There are age and gender differences in the forms of violence against children that impact children in different settings. From the data, different types of violence are more prevalent at different periods during the life course of a child. For example, if you're a girl, then late adolescent is a key period for sexual violence, which often brings about motherhood in childhood. UNFPA reminds us that annually in developing countries, a whopping 7.3 million girls under the age of 18 give birth. This is unacceptably high. Both girls and boys experience physical violence, including armed violence, and homicides, as well as bullying and emotional violence. The data show that across the region, girls reported experiencing sexual violence way more than boys. We know that no one policy or set of laws will end violence against children. The same we know for gender-based violence, or more commonly, intimate partner violence. We're certain, though, that a multisectorial approach using various strategies will contribute to ending violence. We're here today to introduce you to and to learn from 7 strategies that, if put to good use by governments, CSOs, regional institutions such as CARICOM, the newly formed regional community of practice and partners, promise to inspire us, so much so that we'll recommit our efforts to eliminate violence against our youngest citizens, our children. Welcome to this first in a series of virtual meetings. I thank you.
Thanks a lot, Mary, and thanks a lot for your words and for talking specifically about sexual violence, which is one of the forms of violence that worries us a lot in the Caribbean, but also in the rest of Latin America too. Latin America and Caribbean have really high numbers of sexual violence. So now, with no more delay, we will have our colleague Britta Baer from PAHO. She will be, as I say before, introducing the the 7 strategies to end violence against children. Britta is the regional advisor for violence prevention, and she has been key for the work on INSPIRE in the whole region for the Latin America and Caribbean, and she works closely with the ministers of health in the whole region to put an end to violence against children. So go ahead, Britta. Thanks a lot.
Great. Thank you so much, Esther, and good morning to everybody. It is wonderful to see so many people connected. Let me share my screen. So I have the challenging task of summarizing INSPIRE in 15 minutes. So bear with me, please. And again, like Esther mentioned and some of the other speakers, this is really a series of workshops. This is the very first one. So I'm going to go through some of the INSPIRE strategies very quickly. We will have much more time to talk about the very first one, the implementation and enforcement of laws. And there will be other sessions that allow us to go into more detail on the other ones. So this is just really to get you interested in some of these topics, and there will be more time to discuss further. So why is this topic important? And I think you heard this already, the sheer challenge of it from all of the opening speakers. We know that 1 in every 2 children and adolescents globally have experienced past year violence. And we know that this includes multiple forms of violence: child maltreatment in the home, bullying in school settings, youth violence in the community, intimate partner violence, including dating violence among adolescents, sexual violence that you just heard, emotional and psychological violence, including witnessing violence in the home. When, for example, a child lives in a home where there's a lot of intimate partner violence. So the challenge is really huge, with enormous consequences. Just to give you some of them, this image shows you the sheer size of like health consequences. This is why it's such a public health priority, because it affects mental health, injuries, maternal and child health, communicable diseases, non-communicable diseases, health risk behaviors. And these are things that to just give you some ideas like of the sheer consequences just on the health side. This image, it wasn't possible to introduce like the education consequences, including both educational development as well as the chances later on for career progression and so on. The economic costs of violence, both in terms of like for individual families and individuals, but also to society as a whole. The consequences are enormous, and these are consequences that we can avoid. These are consequences we can prevent. So this is why this topic is so important. And it also is a topic that really requires the involvement of multiple different sectors, ministries, institutions, professional associations, civil society organizations, as well as this is why we are so excited to have so many of you here today, why it's so wonderful to have different sectors, different agencies, different partners involved in this work, because the work of all of these institutions and actors is needed to really end violence against children and adolescents in all its diversity. And this idea of partnership is not only core to this workshop series, but it's also core to all of the work on Inspire. To advance Inspire, it really requires multiple actors, multiple individuals, multiple institutions and sectors to be involved and take action. And this is why this is really at the heart, and this is why multisectoral partnership or coordination and collaboration is one of the core themes of Inspire. Another key thing to keep in mind when we talk about Inspire is, in my opinion, it's sort of its strengths of Inspire is this emphasis on the evidence base. We all face limited resources, limited capacities, limited time to advance this agenda. And we all pulled into multiple different directions. And I think in this sort of constrained environment, it is so important that what we invest in has the highest possible potential of making a difference, that we really maximize this investment, that we invest in things that we know are evidence-based, that can have an impact. And this is really core to the work on Inspire, that it really stresses interventions and strategies that have been scientifically evaluated, that are found to be effective, and that are available, that are based on the best available evidence with the greatest potential of making a difference. So this is really core to Inspire, not only what is currently included in Inspire, but also it really encourages all of you to share your experience, to document your experience, to evaluate the impact of your interventions, to make sure that we can align it with the Inspire framework and really keep learning, keep strengthening the evidence base to make all of our work more effective together. Inspire is based on 7 strategies, and it really stresses the need for collaboration across these multiple sectors. And you can see some of these on the slide here. We're talking about justice, health, education, social welfare, planning, urban planning, and so on. So this is really a multisectoral agenda where multisectoral action and coordination is urgently needed. And core to or linked to that emphasis on evidence is also the second cross-cutting activity of Inspire, which really emphasizes the idea of monitoring and evaluation, that we need to constantly monitor and continuously evaluate what are we doing well, where we can do better, who are we reaching, who are we not reaching, to keep learning and strengthening the effectiveness of our approaches. So this slide shows you the 7 strategies that are linked to Inspire. Every letter of Inspire stands for one of these strategies. You can see them summarized on the slide, from implementation to enforcement of laws, to norms and values, to safe environments, to parenting and caregiver support, to income and economic strengthening, response and support services, and education and life skills. These strategies each come with a range of evidence-based interventions that I will very briefly summarize. But I think one of the key things, while each letter stands for one strategy, is also to recognize the intersections between the strategies. Excuse me. These strategies don't stand in isolation. In fact, a lot of the interventions that we see on the ground in countries that you might be familiar with, in fact, tackle multiple strategies. So you might be having an intervention that tackles both norms and values, as well as parent and caregiver support. So don't think about these as sort of standalone things, but really the framework allows us to think through a very comprehensive approach to ending violence against children and adolescents that will require multiple sectors, multiple perspectives, multiple disciplines, multiple ways of addressing the issue. And the Inspire framework and Inspire technical package allows us to think through when we're developing national policies, national programs, what are some of these key components that we could consider to advance this broader agenda? Who might be wanting to be involving in our effort? Who could we collaborate with to really reach all children and adolescents in need that are currently affected by violence? So just very briefly to highlight some of the strategies that are included in Inspire. And this very first one will be a focus topic today that I will not go into in a lot of detail because my colleague from UNODC will introduce this in more detail. But when we're talking about ending violence against children and adolescents, of course, the implementation and enforcement of laws, including corporal punishment laws or laws criminalizing sexual abuse, but also laws that tackle some of the risk factor of violence, like, for example, alcohol misuse or firearms access is a core part of it. And we know, for example, from the evidence base that when we do have strong firearm control laws, to give you one example, it can make a real impact in the homicide rate. Homicide, as you heard earlier, is a major challenge in the Caribbean. So we really hope to engage with all of you in some of the discussions on how can we strengthen implementation and enforcement of laws, the very first strategy included in Inspire. The second strategy is around norms and values. We know norms, gender norms and social values are core to preventing violence against children and adolescents. And we have lots of opportunities in addressing harmful gender and social norms, for example, through community mobilization, promoting gender responsive and social equality. We can, there are good practice examples around bystander interventions that encourage really a focus on these things. And we know that when we have programs that tackle these social and gender norms that are at the heart of violence, like, for example, the program OSASA, which has, for example, been adapted to Haiti, we know that it can have an impact on not only as you see on this slide, the reduction in children that might be witnessing intimate partner violence at home. So again, this is an opportunity to tackle not only intimate partner violence, but also violence against children, including witnessing of violence among children in their home, which gives us a great opportunity to be as effective and achieve as much of an impact as we can on the ground. The third strategy, the S of Inspire, stands for safe environments. And we know that the environment, including the physical, but also the social environment that communities, including children and adolescents and their families live in, makes a big impact on rates of violence, risks of violence, but also it opens up a range of opportunities to prevent violence and reduce risk and strengthen access to support. One such example of action include interventions that, for example, interrupt the spread of violence through engaging community leaders. It includes interventions that improve the built environment, for example, making streets more accessible, lighter, addressing school environments. It includes interventions such as the Cardiff approach that deal with or specifically address hotspots of violence. This is, for example, where the health system can come together with the justice system. Health has often a lot of information on where exactly injuries happen. And when you share that information that the health system has with information that, for example, the police or the justice system has, we can really narrow down the area where that is the greatest hotspot where violence might take place in a community, and ensure through interventions such as improved policing that area is tackled and that the risks are reduced, and that interventions target specific areas where our impact could be greatest. And that's an example of the Cardiff approach. The next strategy of Inspire, the P of Inspire, stands for parent and caregiver support. I know that several countries in the Caribbean have advanced this area. We know that supporting parents and caregivers not only allows adolescents and children in the family to flourish, it also has impacts in terms of child development, educational development, health, and including mental health of children and their parents and caregivers. So this is an area where we can have a huge impact, not only in terms of violence, but also in terms of health and well-being of the family as a whole. And there are lots of interventions that have proven to be effective, including, for example, interventions that involve home visits. For example, the nurse-family partnership, where you have like a nurse visiting families in needs to provide support and thereby reduce the risks of violence against children. Other examples use more group-based approaches. So there are a range of interventions that I know many Caribbean countries are implementing and that we hope to support and hear from you, that enable us to support parents and caregivers, and thereby allowing children and adolescents to flourish, really promote their health, promote their well-being, reduces the chances of violence. The next strategy of Inspire, the I, or the second I, stands for income and economic strengthening. We know that poverty intersects with violence, and that we have an opportunity through, for example, cash transfer, saving and loans, and microfinance, often combined with gender equality or gender responsive training for families. That gives us a huge opportunity to tackle some of the risk factors of violence. When a family, especially women, have greater access to household resources, and which is combined often with gender equity training, they're able to invest more in, for example, the health, nutrition, and education of their children. This is also an approach where we have the opportunity of not only reducing the risks of violence against children and adolescents, but also reducing the risks of intimate partner violence, thereby at least, at a minimum, reducing the chances of a child or an adolescent witnessing violence in their home. So again, I know this is an approach that several countries have implemented in the region, and we'd love, again, to hear from your experiences. This is just one example of the image program that has been adapted to various countries in the Americas, including Latin America, that has shown a real impact in the reduction of intimate partner violence, which in turn reduces at least the chance of witnessing violence among children and adolescents. So again, we have strong evidence that shows the effectiveness of these programs, and this is one of the reasons it is promoted by Inspire. Another important area, the R of Inspire, stands for response and support services. We know that when children and adolescents experience violence, it is critical that they're provided with an appropriate response. This response is often multisectoral. It involves a huge part on the side of the health system, an area that PAHO is very engaged on. But it also requires collaboration between health services, child protection services, social services, legal services, to really provide comprehensive support that has sort of the survivor at the heart of it. A core part of response and support service is strengthening the ability to identify at-risk groups, often in health services, but also other essential services. And then followed by providing them with like appropriate support, including first-line support that is informed by psychological first aid, as well as other needed and often timely healthcare that is like that needs to happen. For example, in the case of sexual violence, we know that we only have a limited amount of hours to make sure girls and boys have access to appropriate quality health care that can prevent and mitigate some of the consequences of sexual violence, to a range of mental health and therapeutic programs that can help improve the health and well-being and inclusion of children. So there are a range of interventions that fall under response and support services that can be strengthened and that have proven to be effective to address the diverse needs of child and adolescent survivors of violence. This is why this is such an important area, part of the Inspire package. And I know that a lot of the Ministry of Health that are listening right now have been advancing this work, whether this is through developing of health system protocols, and whether this is like strengthening pathways across essential services, or other support. So again, I want to encourage you to share these experiences.
Brita, 2 more minutes to.
Yes, almost done. I'm now at the E of Inspire, which is the very last strategy and stands for education and life skills. We know that education is not only by itself a protective factor against violence, but it's also a huge opportunity to prevent violence, whether this is by increasing enrollment in schools, whether this is by creating a safe and enabling school environment, whether this is within school, strengthen the skills and the knowledge of children to protect themselves, to improve their life and social skills, to deal, for example, to improve their communication skills, to be able to deal with aggression. And it's also a key setting to start tackling intimate partner violence and dating violence among adolescents. So again, education is such an important part of it. And there's strong evidence that when we invest in, for example, programs that promote life skills and communication skills among children and adolescents, we can have a real impact on aggressive and disruptive behaviors in school settings. So there's a huge opportunity to again end violence against children and adolescents. I want to stress that Inspire, the technical package, the 7 strategies that I've summarized very briefly, comes with a range of resources that partners and Inspire have developed. That includes the technical package, the handbook to guide you on implementation of these strategies and guidelines. There's an M&E framework, given the emphasis on evidence and monitoring of innovation this quarter Inspire. There's a scale-up guide, as well as an online course that is free and self-paced, that's available to all of you to build your skills in this area. Also, I should stress that partners are keep developing new resources to really make sure that we have a range of tools available to countries and organizations and individuals that are interested in advancing this area. I'm going to end here, but again, there will be chances to go into much more detail on each of these strategies. Please do look at these resources that I've flagged. Many of these are available on this website that I've linked here. And the idea of Inspire really is that vision of when we invest in these 7 strategies and these evidence-based interventions, we can reduce the prevalence of violence against children and adolescents globally and in the Caribbean. So it's really important to engage with all of you and to learn from all of your experiences to take this agenda together forward. Thanks so much, and over to you, Esther.
Thanks a lot, Britta, for this introduction. And as Britta said, you have all the materials, and we will share also the presentations and the recording that we are doing from today's webinar. Thanks a lot to all the people that have joined during the webinar. As I'm saying, you will have all the materials, and this is just the one of one series of webinars regarding Inspire. Now we will go into depth into one of the strategies, as it was announced. Is the first strategy is the one on implementation and enforcement of laws. And we have the pleasure to have today with us Diane Farias-Picon from UNODC. She has been also accompanying other trainings in the region. So please go ahead, Diane. Thank you. You have 5 minutes.
Thank you very much, Esther, and good morning, ladies and gentlemen. It is a real pleasure to be able to participate today on behalf of UNODC, and I'm very pleased to present on the first strategy today, implementing and enforcing laws and the enforcement of laws. So it's important to highlight here, legislation is a key component for preventing and responding to violence against children and promoting respect for children's human rights. Effective enforcement of laws that define and prohibit all forms of violence are essential as they may deter violence and ensure justice for victims. So different types of laws address risk factors for violence in children's lives. For example, we have misuse of alcohol, use of sex to weapons, mentioned before by Britt. In addition to this, legislation may also provide an overarching framework for prevention, protection, response, and very important, support for victims, witnesses, and children in conflict with the law. What can include this legislative framework? It can include a strengthening of systems and coordination for the protection, response, and support. This could be done through mandates, standards, procedures, and accountability mechanisms. It also helps to establishing frameworks for identification, referral, investigation, treatment, and follow-up for children who experience violence. And finally, could be also being seen for establishing pathways to fair, transparent, and child-friendly justice. This also includes children in conflict with the law. I'm not going to be able to go in depth in any of them due to the time constraints, but please refer to the materials that have been flagged by Brita. The INSPIRE strategy fits into a larger effort, which is implementing and enforcing laws into a broader rule of law and developmental efforts to protect the children's rights. What is the most important here? That we protect them and that we make sure that they are live free from violence and ensure that there is in line on human rights and international law. So the next slides, I will try to respond quickly to the questions why, who, when, and what are implementing and enforcing laws. So why it is important? Because we have this objective, ensuring the implementation and enforcement of laws is key to prevent violent behaviors, but also protect children from violence. Some examples of that are excessive alcohol abuse and also access to firearms and weapons. The INSPIRE technical package focuses on two types to help to protect children. Laws prohibiting acts of violence against children, including violent punishment and sexual abuse and exploitation. And the second second part is laws that reduce risk factors for violence. That means limiting access to misuse of alcohol and youth access to firearms and other weapons. But who is involved in implementing and enforcing the laws? We have legislators and policymakers. They pass laws and allocate resources. We have the ministry and government staff. They do translate law and policy into protocols, standards, regulations for their sector. Members of service workforce, they do carry the actions. We have also civil society and private sector. They help and contribute to support the community to comply with the law. And we have, of course, families and individuals, the benefits, but also who change their behavior. There are many frameworks for understanding the process of implementation and enforcement of law. But we have decided to take one and adapt it. One is from the US Center for Disease Control and Prevention Policy. And they define policy as a law, regulation, procedure, administrative action, incentive, or voluntary practice of governments and other institutions. As you can see in the figure, we have a cycle that moves from problem identification and analysis, which is essential because without this, you cannot respond to the specific needs at local or national levels, to policy and implementation, and includes also very essential evaluation and stakeholder engagement and education. I would like to point out here the monitoring and evaluation because it's essential to assess progress, to adjust the desired impact with practical actions, but also because help stakeholders to plan, evaluate, and improve interventions to prevent a response to violence. So what exactly means implementing this? It means that we translate into operational practice these standards. It also implementing regulations, guidelines, recommendations, directives, and other organizational policies. It also helps us to identify indicators and metrics to evaluate this implementation and the impact, and assess implementation and ensure compliance with policy. But when are these child protection laws more effective? When they work best? What we have seen, and this has been based on lessons learned, is when they're part of a broader strategy to promote and protect children's rights, including monitor and evaluation. Again, it's very essential. When there is a participatory process, that means involving all the stakeholders, national, local stakeholders through government and civil society, and even the children. Children are essential, and they need to be fully engaged in all the steps and all the processes. Legislation really requires, when we are talking about infrastructure or services, that is costed accurately, and the allocation of resources are done. Implementation also is accompanied by ongoing awareness resident efforts. to change social norms, but also to improve and support the professionals to gain skills and be supported to the programs, as well to the parents and the children themselves. What are inspired approaches to implement? So you can see here the 4 approaches that was mentioned by Britta, so I won't repeat it, but please note that these represent evidence-based and promising practice in preventing and responding to violence against children. So we have these 4 type of laws that may help you and are part of the strategy and Inspire. Why this strategy should be linked to others. This is very important because as you can see, violence is a phenomenon that is very, very complex, and it has to be addressed from different sides and to be looked from a holistic point of view. So that's why if we don't look at the others, norms, values, safe environments, parenting, caregiver, or other strategies, we are not really responding to violence against children. An example of this is, for example, laws signaling violence against children is unacceptable. If we have a law prohibiting, for example, the recruitment of children, this shows that it's unacceptable that any criminal or organized group can actually recruit the children. And it's part of the values that we want to change through law. Another example also is when we have these laws, we also complement the efforts to promote safety and use of public spaces. For example, when we limited and we have laws preventing alcohol misuse or also access to firearms, we contribute to safety, to public safety. And this is a quick summary of the first strategy, and over to you. Thank you. And I wish you the best discussion.
Thanks a lot, Diane. So please, if you have any question, you can put it in the question down there, and we will move now to specific examples regarding this strategy on implementation of laws. So now we will have good practices of ending corporal punishment, specifically from Bess Herbert and Sonia Bojito. They both work for the Global Initiative to End All Corporal Punishment of Children. And first we will have Bess. Bess Herbert is advocacy specialist on corporal punishment. She has worked to advance children's rights for over 20 years. And she was advocacy and partnership manager for the Global Initiative to End All Corporal Punishment for Children for 10 years. And Sonia Bojito will accompany her. She joined the End Violence Partnership as legal policy specialist. She worked previously also for the Global Initiative to End All Corporal Punishment of Children for 11 years as Africa project coordination. So please go ahead. Thank you.
Thank you, Esther. In fact, it is going to be Sonia starting first. So thank you for having us. We're going to talk about the global campaign to end corporal punishment of children in all settings. I will start the first part of the presentation by talking about the human rights obligation to end corporal punishment of children. I will set the context. And then after that, in the second part, Bess will talk about, she will give concrete examples of national experience of ending corporal punishment of children, banning and then implementing laws to end corporal punishment of children in some specific countries. So to start and then set the scene, talk about the definition. At least we could clarify the definition of corporal punishment of children. And then, as you can see, as defined by the UN Committee on the Right of the Child, corporal punishment is a punishment in which physical force is used and intended to cause some degree of pain or discomfort, however light. We underline, however light, just to make sure that there's no degree of pain. So usually when we have laws prohibiting violent punishment or torture or severe punishment, obviously these laws do not prohibit corporal punishment in all settings. And then the UN committee also recognized other non-physical violence form of punishment. So it could be insulting children, humiliating them, threatening them. So this is the definition of corporal punishment as based on the CRC understanding. So why is it that we should ban corporal punishment? Well, because it's a human rights obligation under the UN CRC and other international and regional instruments, and because it's the most common form of violence against children. And also corporal punishment comes at a higher cost to the child and to the society. And then we talk more about the harmful effect of corporal punishment on children in the next couple of slides. Next. And another reason for us to want to achieve full prohibition of corporal punishment is because it's also a global development goal, SDGs. You may know about the target 16.2 of the SDGs, which require states to prohibit, not to prohibit and eliminate corporal punishment in all settings by 2030. But it also concerns SDG 3, which is about the good health, because corporal punishment is a public health issue. SDG 4 about quality education, because we have corporal punishment in schools, and SDG 5 because there's a gender dimension in the infliction of corporal punishment on children. So if we go to the next slide. Also, why do we want a law to prohibit corporal punishment? We're often asked, why should we have a law? And why don't we just maybe ask parents or teachers to change their behavior? And then as our colleague from UNODC said, it's important to send a clear message with a law. At least it shows that violence against children is not acceptable. In the same way we have law prohibiting violence against women, we can have law prohibiting corporal punishment of children, and obviously violence against children. So it's a campaigning tool to have a law, and also in implementing the law, we can protect the best interest of the child. So it's not a matter of sending parents or teachers to jail. We also have to consider the best interest of the child. And also it's not, sorry. Oh, so I'm going ahead. And also it's not a matter of prosecution. Research has established that with prohibition, there's no higher prosecution of adults. So there's no link. Banning corporal punishment doesn't mean parents, adults will be prosecuted. It's a matter of education and prevention. Next. We were talking about the harmful effect of corporal punishment on children. We can see we have a plethora of research about the harmful effect of corporal punishment on children. We have direct and indirect physical harm, death, injuries. We also have poor mental health issues, depression, antisocial behavior. Even in the school setting, we have poorer educational outcomes. We have children dropping out of school because of corporal punishment. We have increased aggression. And also, as they grow, as they become adults, children also can display the effect of corporal punishment and become more violent with their partner. Currently, so this is the global context. Currently, we have 63 states that have prohibited corporal punishment in all settings, including in the home. Hopefully, it's not even hopefully, by tomorrow, we're going to announce the 64th state, which is Zambia in East Africa. So you can see even in the next slides that the corporal punishment, state banning corporal punishments are in all regions, you can see. So in orange, yellow, you would see then the states that have prohibited in all settings, which represents only 14% of children. So we obviously need more, especially if we're aiming to meet the target of 2030. Next. And this is the regional picture of a state that have prohibited corporal punishment in all settings, including in the home. So you will see that some regions have not prohibited in there's no country that have prohibited corporal punishment in all settings in some regions, for example, in the Caribbean, but also in North Africa, in North America. So we're talking here about Canada and the US. But the country with more prohibition, the continent with more prohibition is Europe, and then followed by Latin America and Africa. So now we're going to go with Bess, who give concrete example of a prohibition, implementing prohibition in specific countries. Thank you.
Thank you, Sonia, and thank you, Esther. It's great to be with you all today to talk about corporal punishment, and I'm going to talk a little bit about specific country examples, some of the countries that have enacted laws and how they've done that and some of the effects of that. So Sweden was the first country to prohibit all corporal punishment of children in 1979. And it has taken a very comprehensive approach to putting the law into effect. So the government financed an education and awareness raising campaign using mass media over 2 years. It produced a booklet which was called "Can You Bring Up a Child Successfully Without Smacking and Spanking?" So it described the law and the purpose. It included advice to families and services that could help families. It was sent to all families and all households and translated into several languages. The ban was also discussed in all schools, and famously it was advertised on milk cartons that families had on their tables at breakfast. And then lots of training and publicity was delivered by NGOs and by government departments. And the really important thing to notice about Sweden is that they have continued to do this for 40 years. And the effect has been that when the ban was introduced, there was around a 70% support for or acceptance of some level of corporal punishment in child raising. And since around the year 2000, that's been at around 1 or 2%. So a really big change in acceptance of violence in punishment, violent punishment in Sweden. Okay, so the next example is Namibia, which prohibited corporal punishment in schools in 1991. The Ministry of Education produced a manual for trainers on positive discipline, booklets for teachers also on positive discipline, and a nationwide in-service training program to help principals and teachers to adapt to the new law. And the Legal Assistance Centre, the NGO, produced a number of resources to support the change in law, such as comics, short animated videos, training for community members, and research briefs on alternatives to corporal punishment. And this is one example of one of the comics that they produced, Alternatives to Corporal Punishment, and kind of encouragement and information about how to progress. The next country example is Colombia, that prohibited all corporal punishment in 2021. And it was really a kind of a big, bold step to try to eliminate violence in their society. So the prohibiting law included a requirement to develop an implementation strategy within 6 months. So they had 6 months and they developed a very, very comprehensive, very progressive strategy. And you can see this kind of circular hexagonal diagram includes the kind of dimensions that they tried to draw on. So human rights and intersectionality and gender and human development and no harm actions. So they tried to draw on all of those themes. And then they came up with 4 components of the strategy, which are knowledge management, strengthening and capacity building, participation and social advocacy. And they really engaged with lots and lots of different community members and sectors in developing the strategy. And the strategy will include lots of communication, community engagement, and support for parenting. And then the final example is Wales. So Wales enacted prohibition in 2021, and they gave themselves 2 years to prepare for the law to come into effect. So the law came into effect earlier this year in March. And they, again, take a really impressive, comprehensive approach to putting the law into effect. Their 3-pronged approach was to A, change the law, awareness raising, and ongoing support for parents. Those were their priorities. And again, they did widespread stakeholder engagement. So they held at least 170 meetings with different community groups, all the different sections of society that they could think of to meet with, to explain the law, to listen to their concerns, and to incorporate that knowledge into the information and support that they were producing. And they're also carrying out research on the effect of the law. What effect is it having on public opinion? Is it being implemented effectively? So there'll be a lot to learn as they go forward. And they had a really excellent communications campaign. Oh, I've gone forward too quickly. There we go. So there's they have a parenting website, which is called Parenting, Give It Time. And they've had a great communication campaign, including a TV advertisement at the bottom, which maybe I'll try and play if we get time at the end. And then if you want more information about what Wales has done, then there's a link here to kind of a more comprehensive explanation of how they've put their law into effect. So how is a law prohibiting corporal punishment put into practice? We think there are 5 key steps. The first one is to enact the law to ensure that the law prohibits corporal punishment. The second one is to plan and coordinate to develop a costed national action plan and to integrate the new law into existing child protection systems. Make sure that everyone understands it and understands how it's going to work. Number 3 is communicate. So public education and awareness raising. Make sure that everybody knows that this law is now here and what it means and what they can do about it. Number 4 is support. So support parenting, support teachers, support carers with information, with practical support. And then number 5 is evaluate. So monitor the impact of the interventions. And we have some implementation guidance available in 9 languages that explains these steps in more detail. So what's the impact of prohibiting corporal punishment? So when the law is implemented well, we see a consistent decline in use and approval of violent punishment in child rearing. So as I said, in Sweden, the approval dropped from 70% to 2%, and we see that in many countries. But really interestingly, some research shows that there are impacts on wider forms of violence. So in Sweden, there have been connected declines in theft, narcotics crimes, assaults against young children, rape, suicide, and use of alcohol and drugs by young people. Researchers have found in Finland a similar decline in the number of children who are murdered, and in Germany, linked decreases in violence by young people and reductions in the proportion of women experiencing physical injury. And what we think is that a law on corporal punishment helps the whole of society to reevaluate its acceptance of violence against children. It kind of causes a society-wide conversation to happen about why do we accept violence, and it generally leads to less acceptance of violence. So just very quickly, a few factors that assist in achieving prohibition. These include political leadership, persistent campaigning, the domino effect of neighbouring countries, shift in public opinion, often very sadly it's individual cases of child abuse, and sometimes just a lucky window of opportunity. And then possible obstacles include cultural and religious arguments, countries with multiple legal systems, countries with federal systems, lack of political leadership, political instability, and sometimes prohibition is included with controversial other issues, and that can hold the issue back. So just to finish, this is our website. It's a global knowledge hub on corporal punishment, and I'll share the link in the chat. And do contact us with any questions. Thank you so much for your attention, everybody.
Thanks a lot, Bess and Sonia. It's great that we have these specific examples from other countries. And now we will have an example from the region. And we have the pleasure, as I say at the beginning, to have in the Jamaica example, to have Miss Hessin Blair who has accompanied us in other meetings from the Ministry of Education and Youth in Jamaica. So please go ahead, and then we will have time for questions, but please do not hesitate to put your questions here directly in the questions and answer. Thank you. Go ahead.
Good morning. Good morning, everyone, again. Are you seeing my screen?
Yeah, we are seeing the screen, just that we need to see it in presentation mode. You're seeing it.
Okay.
Now, great, perfect. Thank you.
Okay, thank you. Thank you for this opportunity to share with you this morning. We're going to be looking at the implementation and enforcement of laws from where we are in Jamaica. We are not, we are on the journey towards banning corporal punishment. So we will just go through these examples very quickly to show you where we are. So in our context, we know that we have a population of about 3 million persons with approximately 770 children. And we also know the research has shown that there are high rates of family violence affecting children. And this includes violent discipline as well as sexual abuse. There's also high rates of youth and adolescents violence, and this includes gang violence, sexual violence, cyberbullying. And we have research that shows that we have students between the ages of 13 to 15 reporting at least one physical fight in the last year. And that and especially since COVID, we have had a surge of online, online violence of some sort in our context. So what have we been doing in terms of dealing with the issue of addressing violence against children? Now, just as a background, Jamaica was designated as a Pathfinder country in 2016, and coming out of that, a national plan of action for an integrated response to children and violence was developed and approved by a cabinet in 2019. And this plan is based on the INSPIRE strategies. Now, it provides the NPACV, as we call it. It provides a coordinated and structured approach to addressing the issues of children and violence, and especially for children as victims, perpetrators, and witnesses of acts of violence. And this national plan has 5 outcomes. And the one we're going to focus on is the first one, which speaks of strengthening the policy, legal, and regulatory framework just to ensure the protection of children from all forms of violence. Now, there are 3 main strategies that were outlined in the national plan to establish a stronger policy, legal, and regulatory framework. And it speaks of strengthening and accelerating the pace of development and revision of laws and policies for the prevention of violence against children in accordance with international requirements and standards. It also speaks to improving enforcement of existing child laws and acts, and to strengthen the capacity and to promote increased legal awareness about children and violence among key stakeholders. Now, so far we have identified within the national plan 12 laws and 5 policy instruments for review and strengthening. And I've just listed some of them here. There's a Child Care and Protection Act of 2004 that is currently being reviewed. The Education Act and regulations are also being reviewed. Child Labor Regulations, Sexual Offences Act, Child Pornography Prevention Act, the National Sexual, Reproductive and Health Policy. Ministry of Health and Wellness is leading on that, and they have recently received Cabinet's approval to develop that policy. A safe school policy is currently in a draft, well, a green paper stage, which is allowing for public consultation on the policy, and Children's Code for Programming is currently being revised. by the Broadcasting Commission. So what does the current situation is with regards to corporal punishment? We have in the Child Care and Protection Act bans corporal punishment in residential childcare facilities. Now, in 2005, the Early Childhood Act bans corporal punishment in early childhood institutions. In 2008, the Ministry of Education issued a policy directive to strongly discourage corporal punishment in all schools. However, corporal punishment is still lawful in the home under the common law. And the Education Act or Revelation does not provide, does not give any provision that really expressly authorizes or prohibits the use of corporal punishment as a disciplinary sanction in school. So that is the current situation. However, the countries that are placed know where the actions have begun, the discussion has started, and towards banning corporal punishment. We have the political will where the government has expressed in various fora the commitment to prohibiting corporal punishment in all settings. We have in 2019 a special session on violence against children in Parliament, where a group of children presented to the Parliament for the first time in Jamaica. And this special session prompted commitments by the PM and the leader of the opposition to take urgent action to reduce and prevent violence in keeping with the National Plan of Action. We have been engaging our stakeholders. In May 2022, the government with UNICEF support hosted a national policy dialogue on ending violence against children. And the commitment coming out of that policy dialogue was this call to action in which the first priority was accelerating the legislative process to prohibit corporal punishment in all its settings. So the discussion is ongoing. The work has actually started because the current amendments to the Child Care and Protection Act, the amendments have been drafted, and the matter of corporal punishment is being dealt with under Section 9, which speaks to cruelty to children. And cruelty to children really is a whole section that really deals with physical, emotional, psychological abuse of children. And so the revision of the act is proposing that the prohibition of corporal punishment in all settings, and that it should extend to how parents, guardians administer discipline to their children. At the same time, the law recognizes the ability of parents to discipline and to guide their children using nonviolent means, as well as to encourage alternatives. And so we are on the path of abolishing corporal punishment. It is going, and we have started in terms of revising the legislation, as well as having the discussions on it. While legislation in our context takes a little time in terms of its revision and processing coming to a conclusion. And so the strategy that we're engaging on is working on the legislation, as well as starting the dialogue in terms of public education. And so we're designing, working with the National Parenting Support Commission, as well as working with the Child Protection and Family Services Agency in terms of having the public discussion, public education, and giving support to parents. So the amendments in terms of the law, they are under review by the relevant stakeholders, including the Ministry of Legal and Constitutional Affairs, as well as the Children's Advocate. In terms of the steps following the receipt of those comments from these key stakeholders, the revised document will be submitted to the Legislative Committee of Cabinet. From there, it will be discussed and recommended for advancement to Cabinet. And in a nutshell, that's where we are. We are having that, looking at the countries that have ban corporal punishment in all its setting. We're having dialogue with, we had dialogue with Wales just to look at how they have dealt with it and really to take from the different countries the best practices that we can incorporate in our Jamaican setting. Thank you very much.
Thanks a lot. It's always a pleasure to hear you, and we are really happy to see the advances in Jamaica, and we hope you have the law soon. So now we open the floor for questions. If you have more questions and you haven't written them, please feel free to raise your hand. We don't have a lot of time, but if you have any questions for any of the speakers, of any general questions, please feel free to raise your hand and we will open your mic. No questions. As
there were raised hands before.
Yeah, but no.
Yeah,
No. I'm checking. So if there's no questions, we really appreciate all of you for joining today. As we have said at the beginning, this is just the first of a series of webinars, and the idea is also that you can share your experiences, your examples of what you are doing, for example, today regarding implementation or having new laws specifically. So it will be great if you can share also what you are doing. So if you want to share any examples, the floor is open. If no, just to let you know that as we say today, you have seen we have 7 strategies to end violence against children. Today, we just gone through the first one with the specific examples from the region and from outside the region. The idea is that we have at least 3 more three more webinars on the other strategies. So we will have 2 strategies per day, and the idea is to have finally an extra day of all the cross-cutting issues and also on evaluation. So we would like also to have specific examples from different countries. We are approaching some of you, and also to let you know that in this work, we are working closely together, different organizations that are part of Inspire. And today we have our colleagues from Violence, UNODC, PAHO, and UNICEF, but we will invite also other colleagues that are part of this initiative, like such as the World Bank, Together for Girls, but also civil society organizations such as Save the Children and others that are part, Plan International, of these efforts. Please share with us any example, any recommendation also, because the idea is that this is also a space to share experiences, because we can learn a lot for good practices from other countries. So once again, thanks a lot. We are approaching 11:30 Jamaica time, so we will be closing now. We will be sharing to all of you. We have all your emails. We will be sharing all the presentations and the recording for today, and we will advance for the next one. The idea is to have another one at the beginning of December. We are checking agendas. If not possible, we will have all of them in the first semester of 2023. The idea is that we have these short sessions in order not to take so much time, but to share as much information as possible. Thanks a lot again, and have a great day. Thank you.
Thank you. Bye-bye. Thank you.
You're welcome.
Yeah.